Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Sinise, and we're going to be talking about patient education, everything you wanted to know about urologic procedures. We discuss every Saturday at 10:30 a.m. Central Time. So join us every Saturday, whether you want to watch us on Facebook or on YouTube. We don't really mind either way, whatever works best. All of our programs are available on demand on our website at uropatient.com. So be sure to check out our website to learn more. So we're going to get right into our episode today. And today we're going to be talking about ureteral stents, understanding a little bit more about them. So let's take some of the mystery out of the ureteral stent. So first thing we need to do is talk a little bit of anatomy for you. So this is what it looks like from the inside. These are your kidneys that produce the urine. It flows down these tubes called the ureters. That's what we're going to be talking about stenting today. They then go into the bladder, which fills up and stores urine. So kidneys make urine, ureters transport urine. The bladder is the storage organ. And sometimes we need to put something in there to help that heal. So let's talk about that. Why do we do this? Why are stents necessary? So a lot of surgeries that involve the kidneys or the ureters, such as kidney stones, etc., can sometimes cause blockage or damage to the ureter. And a stent is put in place to help it heal or help it keeping it from getting blocked. So what's a stent look like? Well, it's just this thin tube that you see here. It has a curl on both sides, and it's allowed to sit up inside the bladder. It's placed surgically. You're going to be asleep for this, so it's not painful to have done. It's placed here, and it runs into the bladder like that, and it just works as a little bypass tube. And this is what they look like in real life. They come in all different sizes and different materials, mostly silicone and polyurethane. They are placed and they are only temporary. They're not left in permanently. Now, we do have our 5H questions that I like to cover with every procedure that we have, and this is no exception, except I do have the fortune to have one of my close associates, a Dr. John Lynn, who was a urologist out in Arizona, also was a guest on my regular nursing show, which is called UroNurse, and he's going to talk to you about stents. I think he did a good job of covering it. So let's bring John in right now.
I want to talk about something that is apparently dreaded by a lot of my patients, especially after I take care of their stones in the kidney or the ureter. For those of you who don't know me, my name is John Lynn. I'm a urologist in Gilbert, Arizona, and I work at Sunrise Urology. I did treat a patient with kidney stones, and often when I talk about this type of surgery, a lot of patients are telling me that they're afraid of what's called a stent. A stent tube that I typically place at the end of the procedure when I go up with a telescope to take care of a stone using laser, etc., is a tube that I put into the patient to help drain the kidney. And it looks something like this. This is what a stent looks like. This is one size. They come in different lengths and different diameters. This is a much thicker one. This is typically the one that I use, which is the 4.8 French. That designates the diameter of the stent. And they come in different sizes and lengths, obviously. So depending on the patient, we will put in the appropriate length and diameter stent. But typically, I like the smaller, thinner stent because patients tolerate it much better. First of all, the reason we put these stents in, a couple of them. Number one, these stents will, after we take care of the stone, will help drain the kidney because the stone is stuck in a tube, and that tube gets swollen. Even if the stone were to just pass, or we were to simply remove the stone, the tube or the ureter can get blocked up. And these things, or the stents, are placed from the kidney all the way down into the bladder, and they help that ureter, that drainage tube, drain the kidney. It causes pain because the stone is causing blockage and back pressure of the urine into the kidney. One of these stents helps relieve that back pressure and allows the kidney to drain and takes care of the pain and also the possible infection and things like that. In addition, if I have to go up with a telescope and use laser, sometimes I've been having to drive the scope in and out multiple times. The fact that the scope has been going in and out of the ureter can also cause trauma or edema, swelling after surgery. Even though the stone is gone, that swelling after surgery can block the ureter, So when the stone is gone, the ureter continues to be blocked, and one of these things allows the kidney to drain so that the pain is relieved after the surgery. So you don't want to say that the surgery is a success and yet the patient continues to suffer pain. The way I put these in is that they completely stay inside the patient. I do not have a string sticking out of the patient at the end of the procedure. That gives the, whenever there's something sticking out of the patient, there's a small chance of the patient accidentally pulling that out. So that is something that I try to do, not leave a string at the end sticking out of the patient. So let's talk briefly about removal of the stent. Removal of the stent is done in the office using a small telescope. I drive that small telescope into the bladder. And within the telescope, I use a small grasping forceps. And by grabbing the end of the stent is straightened out and it comes right out of the patient. And that is something that can be done in the office. It takes about 15 seconds or so, and it should come out pretty easily.
Thanks, John. I think that was a great explanation that he gave us on the stent. Absolutely. It's a very simple procedure to have it removed. Again, you're asleep when it's put in, so no discomfort from that. Now, what's it like to wear a stent, to have one in? Well, some patients have stated that, they can feel it when they urinate because it does sometimes cause urine to back up into the kidney. So there can be some discomfort with it. May make you urinate more frequently. Some patients don't even notice they're in. Now, one thing I did want to mention with this slide here is potential complication with the stent. And what you're seeing here is a stone forming around it. So as I mentioned, these are done temporarily. They can't be left in. It's really important if you have a stent in place that you make sure you remember it's in place and find out when it's going to either be changed or removed. Because if it's left in too long and forms a stone around it, it could be serious. It could cause big complications. They have to be taken out and removed at a certain point. Now, all stents have different lengths of times they can be left in. Some of them, up to a year even. So it is unusual, to have a stent in that long. However, make sure you do check with your urologist and don't forget you had it in. I can tell you there's been some horror stories where patients came in years later and didn't realize they had a stent in, and they came in with blood in the urine, and that's what we found. They go, oh yeah, I remember that now. So real important. Dr. Lynn did explain about a string that can be sometimes attached to it. Some doctors like to put them in, some don't, but it's a string that's attached to the stent, and it actually is coming out, as we see in this picture, outside your urethra. So it's hanging outside you. Now, that means that when it's removed, you don't have to go in with a scope in the office. So it avoids the cystoscope. You can just simply pull the string out and it comes right out. Not painful to do at all. The problem with the string, and I think Dr. Lynn did kind of refer to that, was that sometimes patients accidentally will catch those strings. And I had one guy, he was drying off with a towel and he caught it by accident and pulled the stent out. They come out too soon. They're there for a reason. Could be another trip to the OR to have it replaced. So keep that in mind. So in conclusion, stents are very safe, very simple to put up with, not much on the patient's part. They're easily removed, very little pain and discomfort for that. Now, I do have a handout for you on that. Again, put out by SUNA, so our Society of Urologic Nurses and Associates. So go to the website and just click on that download area. It'll bring you right over to the handout. It's a great thing to have at home so you have something to refer to. Now, next week, we're going to be talking about how a prostate biopsy is done. So join us next week. A little different time. You may notice here that says 11 o'clock because we're going to be doing UroNurse a little bit later that day. I've got to postpone this program a little bit too. So it'll be starting at 11 o'clock instead of our normal 10:30. But anyway, you can always find us on demand at our website. And it's really been great to have everybody here and hope to see everybody next week.